This slide's presentation will give you an introduction to outcome measures. Outcome measures are something you're going to learn a whole lot more about depending on the course that you're taking here over the next 3 years. The basic purpose of outcome measures are to evaluate the patient's change over time, to discriminate between or among different groups, and to predict the patient's future status. Overall, this PowerPoint is going to talk about different psychometric properties and good things to look for outcome measures. And I'm also going to show you a really good database where you can go and find outcome measures. But for the purposes of this introduction, it is just an introduction. You're going to learn how to use outcome measures a whole lot more throughout the course of the next 3 years. An outcome measure is a tool to assess a patient's status and identify changes associated with providing an intervention. Okay, that's what we do in physical therapy. We're going to assess the patient before we work with them. We're going to provide some sort of intervention or treatment, and then we're going to reassess to see how effective that treatment was. So measuring health outcomes requires a conceptual framework for understanding health, and that framework is shown in this slide. It is the most internationally accepted standard for understanding functioning and disability, and it was introduced in the year 2001 by the World Health Organization. It's called the International Classification of Functioning, Disability, and Health, also known as the ICF model. It's a classification of health, not only health, but also health-related domains. And it acknowledges the interaction between different aspects of health, individual attributes, as well as environmental factors. So if you look at this slide, you can see at the very top we have health condition. That means how a person is doing. And how a person is doing is dependent on body function and structures, also known as impairments. Examples of specific impairments would be decreased strength, decreased range of motion, and decreased sensory function. Or the health condition can also be reliant on activity limitations, such as the ability to move or lift weight or walk. And also participation restrictions are going to be really important for this health condition. So participation restrictions include things like not being able to go to work or not being able to perform recreational activities. Again, this is all dependent on environmental factors. So where the person lives, if they're not able to put any weight through their legs and they live in a house that requires them to go up steps, that's going to be a significant problem for them as far as their health is concerned. Also, personal factors would include things like age and any comorbidity that the person has. So as far as outcome measures are concerned, uh, all outcome measures are going to deal with any one of these things: body functions and structures, activities, participation, personal factors, environmental factors. Okay, they're outcome measures that are going to assess how the person is doing in any or all of these domains. Essentially, there are two basic kinds of outcome measures. There's a questionnaire type outcome measure that's a self-report either by the patient or by their caretaker. And there's also performance-based outcome measures. Overall, there's a rehabilitation measures database that is shown on this slide. This is a screenshot. And I've also included a link to this database. At the very end of the slides presentation, I'll go ahead and take you through Rehab Measures database and show you some of the features. For the most part, the rest of this presentation is going to be dealing with various psychometric properties of outcome measures. The three that we're going to look at specifically are reliability, validity, and clinical meaningfulness. Sometimes people have a difficulty trying to understand the difference between reliability and validity. Reliability is going to mean that every time you do it, you're going to get a similar result. So it's very reliable. That's going to be important as far as an outcome measure is concerned. Valid means that the outcome measure is really testing what it's supposed to do and it's doing a good job at it. Okay, just a little bit of a difference there. We're going to start first by talking about types of outcome measure reliability. The three basic types that we're going to talk about are shown on this slide. What you see in the picture on the right-hand side of the slide is something called test retest reliability. That means if you have one person that takes the test at one point in time and then they retake the test at a later point in time, you're going to get about the same answer. Okay, moving on to intra-rater reliability. That means that this test is stable when recording by one individual across two or more trials. So for example, the same person performs the test over and over again and gets a very similar result. Inter-rater reliability is going to be two different people perform the test on the same group of people, but those two different people get very similar scores. Moving on now to different types of outcome measure validity. There's lots of different types of validity, but the ones that we're going to be most concerned about are shown on this slide. Criterion validity is going to compare the measure, the outcome measure, to an established measure of the same characteristic. An example of this would be using the Lachman test, which is a test that you'll learn about in ortho that tries to predict the presence of an ACL tear. You can compare the Lachman test results to the gold standard would be an MRI. It's an example of criterion validity. Content validity. Does the outcome measure all the important components of the construct? So for example, an example with that would be something known as the BEST test. It's a balance test, and it is a really good balance test. I think it's one of the best. The BEST test measures all the different possible kinds of balance and rates an individual on how they do with each kind of balance. So all of the content is covered as far as balance is concerned using the BEST test. Construct validity is the ability of the outcome measure to assess an abstract characteristic. Well, in other words, they're looking at different traits, attributes, or skills of an individual. Is the outcome measure capable of doing that specifically, or is it looking at something else? Another example of that would be the Berg balance test. It doesn't cover all kinds of balance, but it does a good job of assessing an individual's balance. Now on to the last psychometric property of the outcome measures we're going to look at, and that would be types of outcome measure clinical meaningfulness. We're going to talk about clinical meaningfulness over the next couple of slides. The first two that we're going to look at are going to be cutoff score versus normative data. The cutoff score is going to designate a positive or negative test outcome. This information could be used to classify individuals into groups, such as putting them into a minimum, moderate, or severe impairment group. For example, a cutoff score could represent the maximum score an individual could achieve on a test and be classified as having a risk for falls. Example of this would be less than 46 on the Berg balance test would be indicative that that person could possibly be at risk for falls. And so it's just, you get this score. If you get something less than this score, if you get something less than this particular score, then the test predicts that you're having a problem. That's a cutoff score. The other is normative data, and normative data just provides normal values for specific variables within a population. It's usually presented with data collected from other measures researchers or clinicians have used in the course of the work in producing the outcome measure. An example of normative data is shown here in the table, where you have age of the person on the far left, the number of individuals that were tested, the time that they received on this particular test, and also the 95% confidence interval, which we just talked about in the previous slides presentation, associated with that particular time. So you can see for, let's say, individuals 70 to 79 years of age, they tested 798 individuals. And because that sample size was so high, they received a point estimate of 9.2, and that would be 9.2 seconds. Their 95% confidence interval, where you can be 95% sure that an individual 70 to 79 years old would be in this range of time, is 8.2 to 10.2 seconds. Two other kinds of outcome measure clinical meaningfulness are shown on this slide, and those are floor effects and ceiling effects. You can go ahead and read the definitions and understand it, but I really think that the best way to understand it is to look at the figure on the right-hand side of the slide. Here you have an outcome measure that is assessing an individual's arm and hand fine motor performance. So essentially hand dexterity, or the ability to move your hands with precision. Okay, if you have a person who's had a stroke, that would be the black box on the far left-hand side of the figure. You can see that the dots that you see there, or those black dots, indicate test results from a person who had had a stroke. You can see that a lot of black dots are down there on the very bottom, close to 0. Okay, this would mean that this outcome measure has a floor effect for a person who has a stroke. A lot of people end up with a really low score because the test isn't able to measure their lowest ability. Okay, so if you're going to use this particular test with people with a stroke or post-stroke, probably not a good idea. You won't get a very accurate measurement. Now, if you move to the right, where you have construction workers, they're shown in gray dots. You can see this test works great for construction workers. The construction workers are all spread out between the numbers 0 and 10, meaning that they all were able to get some sort of measure using this outcome measure of their fine motor performance in their hands. Compare that to the far right, where you have the blue dots indicating the performance of musicians. You can see that this test probably wasn't a good enough test for musicians. They have a lot of really good arm and hand fine motor control because they're used to playing their instruments. Since all the dots, the blue dots there, are collected close to the 10, which is the maximum test for the outcome measure, call this a ceiling effect. So again, this outcome measure would not be a good choice for proficient musicians because it has a significant ceiling effect. Finally, on to the last slide for types of outcome measure clinical meaningfulness. We're going to be talking about 3 different things: standard error of measurement, also known as SEM, minimal detectable change, MDC, and minimal clinically important difference, or MCID. Okay, the easiest is the SEM. The SEM is just the amount of error that you get when using an outcome measure that you can consider as measurement error. This standard SEM indicates no change in the patient. It's just a score that this person might get on one day, might get a little bit different score on the next day, and that would be considered the SEM. No real change has taken place. Now, minimal detectable change, or MDC, it's an estimate of the smallest amount of change that the outcome measure can accurately detect. In other words, it's the minimum amount of change in the patient's score that ensures that the change isn't the result of an SEM, for the standard error of measurement. And then finally, minimal clinically important difference, or MCID. This is the smallest amount of change in an outcome measure that might be considered important by the patient. The important thing to remember with MCID is that the patient notices a difference. Okay, I have a picture up here of Sid, okay, Sydney. So I like to remember the difference between MDC and MCID by looking at the CID or SID. Okay, SID tells you it's all about the patient. It's all about the person. If you can remember that, then I think you'll have an easier time remembering MCID from MDC. MCID or SID is all about SID. It's all about the person. The person has to be able to notice the difference. As I mentioned previously, I just wanted to walk you through the rehab measures database. So if you click on that link that's present on the slide, it'll take you to this page. And this is a screenshot of what you saw previously. If you scroll down, you can see that there are multiple ways that you can filter looking for assessments. You can by assessment type, area of assessment, lots of different things that you can look for. Patient population, body part, as well as cost. Okay, if you wanted to, if you had a particular assessment in mind, you could always search for it. And let's go ahead and search for the DGI, which is also the dynamic gait index. If I put in DGI, dynamic gait index comes up. I can open this, and here's lots of information about the DGI. There's a link to the actual instrument if you wanted to check that out. Here you can see there's area of assessment, how you administer it, lots of different patient populations, diagnosis and conditions that you can use the DGI with, little information about the test and how you perform it, time to administer. But I really wanted to scroll down here and show you why you need to know all those vocabulary words that I just went over in the PowerPoint. When you look here, if you're looking at older adults in geriatric care, if you're going to use the DGI, here's the SEM. The SEM is 1.04 points. Okay, the MDC. MDC is 2.9 points. There's the MCID, MCID, 1.9 points. You also have cutoff scores. We talked about cutoff scores, less than 19, increased fall risk. Inter and intra-rater reliability is excellent for this test. And then there's criterion validity, content validity. Here's some floor and ceiling effects. Okay, so if you're looking for an outcome measure, or if you want to learn more about outcome measures, I highly recommend this site. In addition to what I'm showing you here, there's also information about statistics. Okay, if you look at the statistics page, just click on that and it gives you lots of definitions for anything you ever want to know about outcome measures. But hopefully this PowerPoint covered the basics for you.